how about those body pipes? I mean, when you think about, there's like a lot of them, but we're going to talk about some that get clogged and how you can fix that, because we have Dr. Matthew Dicker on with us from Vascular and Interventional Specialist at Prescott. Great to have you on, Dr. Dicker.
Thanks for having me back, Sandy.
You always bring like the coolest toys, okay? I'm always fascinated by the things that you guys do in your office because they're so miraculous. So we're going to talk about these body pipes that are plugged in. As we were talking about body pipes, I'm going, there's a lot of them. So what ones are you talking about?
Absolutely. We're talking about the blood vessels that run through the body, both the arteries and the veins. There's such a rich network of blood vessels that run through your body to go to every body part. The arteries carry oxygen from your heart to all the body parts, and those can get clogged and cause problems.
Oh yeah, without those, you know, you just don't make it very far, do you?
Exactly.
I mean, seriously, I've heard, you know, once the blood stops, that's it for you.
Exactly.
I mean, there's a lot of things that can cause that to happen, but man, so there's something that you have a very special name for this, PVD.
Peripheral vascular disease, yes, also called peripheral arterial disease. And what that is when those pipes that we're talking about get clogged, plaque builds up in those blood vessels. And if there's a blockage caused by that plaque, it can limit the amount of oxygen and blood flow to body parts and cause some problems. Here we have a picture that we're showing that shows a normal blood vessel with a normal blood vessel wall. And then if you look at a diseased blood vessel, there's that plaque that we talk about, the fatty deposits, the blood clots, other things form to limit the blood flow through those blood vessels getting to those body parts.
Dangerous. What happens if you don't get enough blood to the different parts of your body?
Absolutely. And what happens is your body parts need oxygen, they need nutrients, and those blood vessels carry the oxygen and nutrients to the body parts. Specifically in your leg blood vessels, if your leg muscles are not getting enough blood flow because of that plaque buildup, the muscles start to hurt, they start to get pain. It's something called claudication, and particularly when people are walking, if they're getting cramping in their calves or their legs anywhere, they're not getting enough blood flow, and that's due to peripheral vascular disease, and that's something that we can fix.
Oh my gosh. And I think strokes, if it's in like your carotid arteries, or I mean, there's so many things that if you're not getting blood, you know, your hands can go, all kinds of crazy things.
Yep,
so,
exactly right.
What are the risk factors of people to get this peripheral vascular disease, Dr. Dicker?
Several risk factors. Number one, big one, is smoking, all right? Other things, diabetes, high cholesterol, a sedentary lifestyle, being overweight. So these are some of the things that are very treatable that can cause peripheral vascular disease.
Right, and so when you know these are coming up, I mean, for heaven's sake, it seems like hardly anybody smokes anymore. No, they do. I saw 4 people on one weekend in the Prescott area recently, and I just thought, are you kidding me?
Yeah.
It was kind of a surprise, where it used to be almost everybody smoked. So
exactly.
That's a good one. That's, you know, kind of down, but we still eat too much and maybe not the right foods. And
exactly. And you know, one of the big things, Sandy, is a sedentary lifestyle. You know, they say that sitting is the new smoking. So people just have to get up and move around. The more you're up and moving around, it's promoting your circulation. It gets that blood flow going. So people have to get up and they got to move around.
Ah, well, that shouldn't be too hard for us to do, right?
That's right.
So if you get PVD, we're going to call it that.
Yep.
It's like BVD, but it's PVD, okay, peripheral vascular disease. Is there a cure for that once you get this plaque in your pipes, your blood vessels?
You know what, Sandy, there's really no cure for it, but there's some things that we can do to help prevent it and then treat it once people have it. The biggest thing is lifestyle changes. Smoking, like you said, there are not a lot of people, you know, fewer and fewer people are smoking these days, but you know what? We still have people in the office that have smoked for 30, 40, 50 years. Once they've smoked, the damage is done, so the sooner you stop smoking, the better. Getting up and exercising, like we're talking about, watching your weight. If there's diseases like high blood pressure, you take your blood pressure medicine to lower that blood pressure, to prevent damage to the blood vessels. Control your blood sugars, control that diabetes. If your cholesterol is high, talk to your doctor, get your cholesterol checked. That's something very simple that can prevent the plaque buildup. Take anti-cholesterol medicines. And if things like lifestyle changes and medicines don't work, well, then that's where I come in, and I can go in and I can treat some of those blockages.
Wow, so how do you treat these blockages in your arteries and veins?
Yeah, well, what we have to do is we go directly into those blood vessels. We open up those blocked blood vessels. And 2 of the main things we do are things called angioplasty, which is putting a balloon inside those blood vessels and opening them up, or putting a stent inside. And we have some of those to show you and your viewers, Sandy.
Okay, yeah, these are so interesting. Now, these are stents.
Those are stents. There's several different kinds of stents. The one you have in your right hand is a stent, and the one you have in your left hand is also a stent, but the one in your left hand has a cover on it. That's called a covered stent. As you can see, Sandy, they're both very flexible to fit in the blood vessels, but they're very strong, and they keep the blood vessels open.
And this one is so light. It looks like wire, but it is so delicate. It doesn't. You hardly know you were even carrying it. This has a little more weight and is more sturdy. So this would be for a little heavier kind of fixes or something.
Yeah. They each of those, the uncovered and the covered stents, go in different body parts. But like you say, they feel very flimsy, but they're very sturdy and they're very strong, and they keep the blood vessels open, and the blood can flow through those stents, and those open up those blocked blood vessels.
So you put these on the inside of veins or arteries then?
Yeah, they go on the inside of the arteries, and they stay there, and they keep those blood vessels open and prevent the plaque from coming in and clogging up those blood vessels.
All right, and so you have something very clever here.
Sure.
Tell us about this,
This
Dr.
is an
Dicker.
angioplasty balloon. Here, you can hold on to this,
goodness,
Sandy.
look at this.
So this does not stay inside of the body. As you can see, the balloon is attached to a long tube. The balloon goes to where the blockage is, and we can blow up that balloon, as you see right there.
Look at that.
And
Oh
it
my
pushes,
gosh.
and it flattens and breaks up that plaque to open up those blood vessels. So we put it where we want it.
Can I touch this?
Absolutely, yeah. Feel how sturdy that is too, and how strong that is.
is.
So that goes where the plaque is. We blow up that balloon. We keep it open so it flattens out that plaque. Then we deflate that balloon, and we take it
Pull it
out of the
right
body.
out.
Yep. And then we take a picture to make sure that the blood vessel is open. Slide that balloon out.
So there's a camera on this, or you have a camera that goes onto these?
There's not a camera on this. After we open up that blood vessel, we inject some X-ray dye, and we use X-ray, and we watch that blood flow through the open blood vessel.
Amazing. So you say, da-da, it worked.
Exactly.
Phenomenal.
It's amazing.
Well, it is amazing what you do. I mean, a vascular and interventional specialist at Prescott, and I was telling you about a friend of my mother's who just had an operation. They went in through the femoral artery, in the groin area with one of these kinds of things, went up through the body into the brain and fixed an aneurysm.
Amazing things we can do.
On like camera.
Absolutely, absolutely. And you know what? The only thing the patients see is a little Band-Aid.
I tell you, you guys are amazing. So we're very lucky to have you in the area. Vascular and interventional specialist at Prescott, Dr. Matthew Dicker, thank you. You're always such a fun doctor. I love it.
Thanks for having me, Sandy.
Thanks for what you do.